and Brad, the two most famous physical therapists on the internet.
Hi, I'm Sara Meeks, physical therapist, and I'm here today to show you two exercises that I use for osteoporosis. One is called the elbow press, and the next one is called the arm press. Now, I want to explain this just a little bit. I like to do site-specific strengthening and flexibility exercises with my patients with osteoporosis. So when they are up and moving, they have maximum and optimal movement in their joints. And the two major forces on the bones that we want to have are site-specific muscle contraction, which is what we're going to show you today, and then also weight-bearing forces, which means bearing your body weight through your bones. So this is my husband, John, and he's decided to be a model today for these two exercises. Hello, John.
Hello.
Okay, good. Now, so John is lying totally supine. His legs are straight. Sometimes, I should tell you with these exercises, depending upon the person I'm working with, I do have them bend their hips and knees, but it's just easier today to just have him lie in his most comfortable position so I can demonstrate the exercises. So he's lying in partial decompression. Okay, so, and you notice that I have towels underneath his arms, and I use something like this on most of the people I see because the shoulders do tend to be a little bit higher than the elbows, and sometimes that pulls on the muscles on the neck, and actually people can have neck pain. So the first thing I'm going to do here is not exactly the elbow press. It's a rotation of the arm. What I have found is that the internal rotators of the shoulders are usually quite restricted, and it's much more difficult for people to externally rotate. So I work on the external rotation. Now, before we do the exercises, I'm going to do a little bit of flexibility exercises. So I'm going to take out the towel on both arms, so if you'll just raise your arm. And most of the activities that we do in life, we turn our arms in. So what happens is we lose the ability to turn our arms out. So turning in is called internal rotation, turning out is called outward rotation. So we're looking at two muscles that need work in the shoulders that internally rotate the shoulders. One is called the subscapularis, and that is a muscle that's located underneath your shoulder blades, or your scapula, so that's why it's called the subscapularis. The other one is one called the latissimus dorsi. Maybe you've heard of the lats. That's a muscle that actually attaches to your pelvis, comes up the back, okay, and then makes a twist and inserts into the shoulder. And that one also is an internal rotator. So I'm working at trying to get the people more into external or outward rotation. So this exercise is something that you can do before you start these exercises just to loosen up your shoulders. So he has his palm turned up, and I'm going to take his hand right at his wrist just to hold his hand turned up this way. And John, can you bend your elbow? And then, John, what you're going to do is rotate this arm out to the side as far as you can. And I hold his wrist because he has a tendency to want to turn it in. So I want to get all the outward rotation I can. And then relax, take a breath, and press out. I hold for a second or two and release. Breath in, and then breathe out as you press out. Hold and relax, okay? And then straighten out your elbow. And then we'll do the other arm. So I'm going to hold your wrist. The palm is turned up. We want to bend the elbow. And now rotate this arm out to the side. Hold and release up. And then hold again, down, hold, and release. Take a breath in, breathe out. Helps to breathe with my clientele. Okay, bring your hand up and then bend the other elbow and then do both arms together. So you're going to press both of them out, hold, and relax. We're going to do 3 repetitions. I use a formula of 3, 5, or 8 for most of my patients, 3 for more physically frail. I'm using 3 today because we're doing a video and we just want you to see what the exercise looks like. Okay, and then I would use 5 with some people, and with my more athletic individuals, I would do 8 repetitions, 10 maximum. Okay, so we're ready to do the elbow press. So John, if you'll clasp your hands together, and then lift your hands up and bring your hands down underneath your head. Not your neck, but the back of your head. Now you'll notice that his right arm is pretty much down on the table, but the left arm is not. He has some limitation in motion here, and because this is an isometric exercise, I'm going to take a towel and just place it underneath his arm so he has something to press against. An isometric exercise is defined as muscle contraction without joint movement, okay? All right, so take a breath in. I'm going to place my hands right under your elbows here, and what I want you to do on the breath out is to press your elbows down toward the table. Are you ready? Okay, breath in, and press, 2, 3, and relax. Breath in, and press, 2, 3, and relax. And one more, press down, 2, 3, and hold it right there. I'm going to slide my hands underneath your elbows, and I'm going to try to pick your elbows up, and you don't let me. Ready? Big breath in, and then hold. 1, 2, 3. I'm going to go to 5, and relax, okay? Now take your hands out from underneath your head, bring them back down to the side of your body, turn your palms up, slide them out to the side, and then press your shoulders, lengthen out your arms, and just let yourself relax. Now, sometimes what I do is, depends on my patient population and who I'm working with. Some people are not able to get both arms up over their head. So if they can do one arm, we'll start with one arm, and then we'll go as far as we can with the other one to try to get this motion. So sometimes these exercises have to be modified. What I've shown you here is the full elbow press. It's an exercise that I really like because it stretches out the chest muscles. The pectoral muscles here tend to be restricted in people. It also causes the muscles in the back and the shoulder blades to contract. So that's what I'm after, is contraction mostly of the postural muscles in the back and stretching out the muscles in the front. The second exercise is called an arm press. So John, if you'll turn your palms down and then slide your hands close to your body, this is the starting position. I start in this position because people are mostly used to using the arms in internal rotation. So I start in internal rotation because that's easiest for people. And then as we progress, we will turn your hands facing your body. Just facing, your hands facing your body. That would be in the middle, and then turn your palms upward, and that would be the third position. So we work towards the external rotation. So for today, we're going to do the one with the hands down, the internal rotation. So turn your palms pressing down. Okay, and keeping your elbows straight, take a breath in. As you breathe out, bring the arm up alongside your ear, either arm. Okay, we'll start with the right. Okay, now he's going to be able, I think, to bring this arm right down to the table. Okay, He's got his elbow straight. I'm going to have him drop his fingers down so he gets a nice stretch on his forearm. Now, what happens with this exercise, if people have weakness in the muscles used to press the arm down, they will try to push the arm out to the side instead. It's a modification or a compensation that they make to try to do the movement. So I want you to feel your arm between your shoulder and your elbow, okay? Take a breath in and press the arm down into the table. Press, 2, 3, and relax. Breath in, big breath in, press down, hold, and release. And one more time. Breath in. Always do the exercise on the breath out, the hold, or the movement. And then sometimes what I do is I want you to lift your arm just a little bit, and I'll take his arm, put my hand just above his elbow, and do that movement again. Ready? Breath in, press down, 2, 3, and relax. So I give him a little bit of resistance in that final movement, okay? All right, keep your elbow straight, bring your arm back down to the side of your body, turn your palm up, out to the side, and just let the shoulder relax, okay? Bring your left arm now, keep the elbow straight, up alongside your ear. Now you notice that this arm does not come all the way down to the table. And what he's trying to do is bring his arm away from his ear, and I'll show you this now. So bring your arm out and bring it down to the table. So he can get it closer to the table if he's a little abducted. So it's called abduction. So bring your arm closer to your ear, because we want this full motion. And I'm going to take this towel again and place it underneath his arm so he has something to press against. Straighten the elbow, press your fingers down, okay? Take a breath in, and as you breathe out, press down into the towel. Press straight down toward the table, not out to the side. Press down, hold it, and release. Big breath in, and out and press. Keep the elbow straight, 2, 3, and relax. And one more. Breath in, and then press down, hold, and relax. Okay, now I'm also going to get your fingers down there a little bit more. I'm going to put my hand right underneath, it's called proximal, or just above his elbow. So I'm giving his resistance close to his shoulder, okay, which is where we want it. Take a breath in. I'm going to try to pick your arm up. Don't let me. Ready? 1, 2, 3, press, 2, 3, and relax. Bring your arm back down to the side of your body. Turn your palm up, slide it out to the side, a little bit more, that's it, and just let your shoulders relax down. Okay, now we also, in a previous video that I did, we went through arm lengtheners. That's a little bit different than the arm press, so we try to get a little bit more motion before we do these kinds of movements, okay? Bring your arms both close to your body, palms down. Bring both arms up towards your ears. Come all the way back. And you let the arms go. If this one wants to go all the way down, that's fine. They don't have to be even. Okay, straighten out your elbows, drop your fingers down toward the floor, take a deep breath in, and press both arms down toward the table. Press, hold, and release. Another breath in. Keep this elbow straight. Now on this left arm, I know it likes to bend. Okay, take another breath and press down, hold, and relax. He's pressing against my hands. Hold, and bring the arms back down along the side of your body. Turn your palms up, out to the side, and let your shoulders relax. You can actually do a shoulder press. So you notice that when I'm finished with the movement, I always have him bring his arm down, put them out to the side. This is usually, I call it bringing the shoulder back into good alignment, and okay, letting the shoulders and the arms relax, and he just lies here and breathes, and what I call internalizes the effects of the movement. So that's a demonstration of the elbow press, how to rotate the shoulders in a safe way, and also the arm press. And I'd like to thank John for being such a good model today, and thank you for watching.